Hi, and welcome to Healthcare IT Today. I'm Colin Hung, and today I'm sitting down with Tom Pace from Blackberry. We're talking about cybersecurity and what healthcare needs to do in order to be a little bit more secure. Tom, welcome, and thank you for joining us today.
Thanks. Happy to be here with you. Look forward to discussing, all things healthcare and cybersecurity.
So, Tom, let's just sort of start here. I mean, BlackBerry, it has a name that's been around for a long time. It's also been transitioning from, formerly a mobile company now into more B2B and doing a big push in AI security. What are you seeing and what is BlackBerry doing in the healthcare space?
Yeah, so from a healthcare perspective, I mean, we're treating any vertical or horizontal that we really approach. We have a kind of a full complement of solutions that we bring to the market. So specifically from a cybersecurity perspective, we have what we call our UES platform, which is formerly known as like the Cylance platform. So that's where a lot of the artificial intelligence and machine learning is being leveraged. So from a next generation antivirus perspective, professional services, all of that, and then additionally, the focus that BlackBerry has had kind of on what we call the enterprise of things. So, and that obviously has a big focus area in the healthcare space as a result of the various medical devices and things like that exist in hospitals and healthcare systems. So we really are able to cut pretty wide across the technology stack in general from a BlackBerry perspective.
And before we got on air here, we were just talking about what you're seeing in terms of cybersecurity issues in healthcare versus other industries. Maybe you can share with our listeners what that is. What are you seeing?
Yeah, I mean, so it's kind of a problem that's existed for quite some time where it just doesn't seem to garner the same kind of attention and budget as other verticals. And I don't have a great answer for that. I mean, there's kind of the obvious thing where doctors and hospitals and things like that, their primary job is to take care of patients and patient care. And so anything that gets in the way of that is deemed a significant hindrance, right? And that makes sense, right? That's logical. But what seems to have occurred in this industry is they take it way too far to one end of the spectrum, right? And so if anything is even slightly inconvenient for a doctor or a nurse or a whatever, then they just don't do it or do it the absolute minimum way possible. And what they don't realize for some reason is that in turn impacts patient care, right? The very thing they're trying to improve can be reduced to nothing. And recently, I think it was in Germany, I can't remember, but there was a ransomware attack that occurred in Germany that forced them to basically reroute a patient or move a patient, and then that patient ended up dying. So that's kind of the first fairly well-established cybersecurity attack that has fairly, fairly likely caused an actual death. So whereas when you take other industries like, financial services and things like that,
Right.
if they lose money, I mean, it's not a big deal, right? Number one, they got a bunch of it. It's federally insured, so they're going to get it back most likely. But they spend a significant amount of their budget, time, and energy to protect that from a cybersecurity perspective, and you just don't see the same kind of level of effort being put from a healthcare perspective.
It's almost if healthcare has to take a little bit of its own medicine, right? In healthcare, we talk about preventative medicine, we talk about preventing the disease before it happens. It sounds like the healthcare needs to listen to itself and kind of go, hey, we should take the same approach when it comes to security.
Well, in the United States, we don't believe in that. We like to we don't prevent things. We like to treat them forever. So maybe that's the model we're taking. But yeah,
Are
they
you
take the
seeing
detection and response methodology here.
Are you seeing any sort of more coordinated attacks or anything special happening in the healthcare world right now? Not just because of COVID, but just in terms of in general, or because healthcare is a little bit more vulnerable because it has not made as much investment in this area? Are you seeing anything like that, or is it pretty evenly spread between all the different industries?
Well, I mean, so COVID has undoubtedly caused a increase in attacks against healthcare organizations. So phishing attacks they have been and continue likely to be the number one infection vector and attack originator. So that's seen a significant increase because of obvious reasons. It's very easy to craft a phishing email message that is going to produce a high probability of somebody clicking on it right now, right? Like, hey, your new masks are here. Click here to check them against the inventory, or the new vaccine testing results are in this spreadsheet, whatever. You can create some really juicy lures right now as a result of COVID-19. And then in general, low-hanging fruit is where a lot of these attackers basically go after. And healthcare has just traditionally been low-hanging fruit. So it's not necessarily that things have been targeted, which has happened, right? I mean, that's certainly been the case in some circumstances. But when you're the low-hanging fruit, then more people are going to pick that. Now, the other piece is they do have some very critical and sensitive data that bad guys want, right? You have healthcare records of people that are valuable on the dark web and can allow you to build a dossier of humans for like identity theft and things like that. So there is that. So you have this kind of confluence of low-hanging fruit, sensitive information, and COVID all at the same time doesn't exactly create a recipe for success.
If I was a CEO of a hospital or large healthcare organization, and you were sitting down across from me right now and just talking to me about cybersecurity, what would you say to me to convince me, hey, maybe I should up that budget line item a little higher?
Well, I mean, I would say, what is the number one thing that you care about? And I would hope that would be, well, the number one thing we care about here is, our patients and the care that they're able to receive. And so I would say, okay, good. That's the answer I expected. So as a result, so in healthcare, it's somewhat similar to like critical infrastructure and like industrial control system space in this way.
All right.
The availability is kind of more important than the confidentiality and integrity. Now that's a generalization, right? And there's confidentiality and integrity are super important. So don't let me gloss over those.
Sure.
But availability of like the medical devices and the systems is paramount. And so when a ransomware attack, for example, which have impacted countless hospitals and healthcare organizations, and I've worked on multiple of them. I worked on one overseas where around 30 hospitals were impacted. They had to literally turn off the internet. They had to resort back to paper records track. I mean, it was a complete nightmare, right? So if you want to avoid those kinds of scenarios, then let's increase the budget. And a lot of times, actually, what I've seen is they have the tools in many cases, but they just have them sitting on a shelf, right? And they're not fully implemented. They don't have the people that know how to use them. So you still do need almost certainly an increase in a budgetary line item perspective. But the other problem you run into in countries like, I guess it's a problem either way you look at it. If you look at it in countries where medicine's like more socialized, then you maybe have less money flowing in and out.
Sure.
If you look at a country like the United States, where it's much more capitalist based,
right,
then it's all about profit, right? And getting people in and out fast and dealing with insurance. So, those dynamics need to change in some way to allow the more money to kind of flow through. Whereas a bank doesn't have that problem. I'm a bank. What's my job? My job is to make money. Okay. They can do a really easy risk calculation to determine how much should I spend to not lose this much money. And if that number is bigger than this number, then we're going to spend it. Like, it's really simple. It's not that simple when you have to like calculate the cost of a human life and loss of patient care and things like that. So.
Yeah, and thankfully we don't have that many stories, at least that we know of, where a ransomware attack has interrupted, an organization for days. We've heard
Yeah.
of a few, maybe for a few hours or half a day or maybe a day at the most, and then unfortunately, it sounds like they pay it in order to get to get their systems released. Um, so thankfully that hasn't happened. But I mean, what you're saying is, I mean, the cost of a half day, I mean, just think about that and the impact that it has on patients. Like that should spur people to invest more, both in time and the talent to secure their systems, to harden their systems.
Yeah, I mean, absolutely. It's absolutely, yeah, it's not even a consideration, in my opinion. I mean, and here's the thing, there's a lot of ways to skin that cat, right? You don't need to hire an army of people. You can have a third party. You can have, I've seen some healthcare organizations have kind of come together and have like a shared resource pool. That seems to be an okay approach.
Interesting. Okay.
Some in other countries,
Hmm.
uh, they form these like what would be like a consortium or something.
Right.
That's not the right word, but something like that.
Right.
And interconnect their systems. You can see where that can go good and bad. But so this concept of shared resources can be helpful. That doesn't exist in the United States really, because of how we run things. But yeah, so it's paramount to have those resources available though, for sure.
You and I will have to explore that concept of those consortiums on another interview, because I'm interested in learning more about that. But I am interested in talking to you about something you mentioned right at the top, which is of course, healthcare is kind of at the beginning of the wave of IoT and connecting a lot of devices both inside the hospital now and outside of the four walls of a clinic, at home for, home care patients and so forth. So there's a lot more medical devices now that are capable of being connected and are being connected into hospital systems. And that's a vulnerability point for cyber attacks. What are you seeing in that world, or what are you guys doing in the IoT world to help secure and make those devices more secure?
Yeah, so there's a handful of things. So from a professional services perspective, we're able to do like analysis on embedded devices and medical devices and things like that to help identify, vulnerabilities and risk overall. We also have technology that's able to kind of manage the risk of those devices from like a network perspective. And then we also have our, the endpoint software as well that can be installed on certain components and certain devices, right? So if you have like an HMI, like a human machine interface of whatever, an MRI machine,
Right.
then can put our software on that typically. Can't necessarily install our software on the MRI machine itself,
Sure.
for a bunch of reasons we could talk about if you'd like. But so yeah, we have a kind of a wide swath there. But problem is, a lot of these hospitals and folks in general just don't even know what they have, which is a problem. And then the other problem is who owns the risk of these things? And that's a problem that hasn't really been solved yet. And I think it's going to happen, and it's going to fall on the manufacturer more and more and more. For some reason, people have treated this space like it's so different than computers. It's just a computer. Like
Right.
it takes pictures of your body, but it's just a computer. And we treat it like they release it one time and then it just never needs to be updated and it's perfectly fine. And by the way, we used to do that with Windows
Right.
until the early 90s, right? Until
Yes.
Congress had to literally say, listen, guys, you can't just release an operating system and then never fix it. That's insane. And so then that's how Patch Tuesday came about and blah, 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 blah. And that same level of rigor is coming. And it's already started coming with like the FDA regulations that are come down the pipe. Given the vertical, there's, it just depends on who you're talking about. But it's coming sooner rather than later. So
So we're saying that what it sounds like, I mean, the manufacturers themselves are going to be forced to either by regulation or just by their customers to go, hey, like you need to pay more attention to security. So we need those updates. We need to make sure you harden your systems. You can't just sort of give us something and then expect us as a hospital to make them secure.
Right. I mean, because hilariously enough, if you wanted to, you could, because you
Right.
would basically you'd void the warranty, right?
Right.
Potentially. Also, they operate on this business model where they create a thing that can't be updated on purpose, so that
Right.
you have to buy the next thing,
Right.
which is also insane. Now, that makes sense for certain industries that are very specific, like aircraft, believe it or not. They specifically make those things in aircraft most of the time, and this is also a generalization, so don't hold me that this is like 100% true in all cases. But they purposefully don't allow some of those systems to be updated, because then there's a concern that a malicious update could somehow get
It
on there.
gets
So
screwed up. Yeah, for sure.
if you don't allow it to get updated at all, then okay. There's other risk, but someone smarter than me does that risk calculation. But that's what you see with a lot of these devices is they make them so you have to buy the new one whenever, and there's no other way to go about it, even though it's just software. It's just software.
If I was a CIO of a healthcare organization, and we're in a video call like this, being properly physically distant, what advice would you give me? What can I do today to start me on a path to becoming more secure? Is there something simple I can do? Is there something that sort of like really doesn't take a lot of effort, but would just start me on the path of becoming a more secure organization?
I mean, I think if you're coming in new and kind of fresh to an organization, I think it always makes sense to pick some measuring stick, and it doesn't really matter which one you pick. I seem to think things like HIPAA aren't super exciting or important, to be honest with you. Like, it's patient privacy is important, but it doesn't, like, being HIPAA compliant doesn't, like, every hospital is HIPAA compliant, right?
Sure.
But they're also like the least secure like
Right.
entity. So that's my point. It doesn't, who cares? Great. I'm really happy that you guys meet HIPAA compliance, even though someone just stole all of my patient records. So picking something like the CIS top 20 controls maybe, and working your way down and identifying, or the NIST cybersecurity framework, something like that, and identifying like high, medium, low of implementation, and like where you are from like an operationalization perspective, and then wherever you are the worst,
Hmm.
focus those dollars, time, and energy on. That's what we've done that for tons of organizations, and I think that approach is really good, because then it gives you, like, what we'll do for organizations is come in, we say, what audit framework do you guys want to be measured against? Top 20 security controls, cybersecurity framework, ISO 27001, whatever you want. They pick one, we come in, we do that assessment, we say, here's where you're at, and then we can take those results and then build a roadmap, right? And build a cybersecurity strategy, and then build a time frame and say, okay, in 12 months, we're going to have, right now we're at 10% control coverage. In 12 months, we're going to be 40%. In 24 months, we're going to be 65%. So
Gotcha.
you can't manage what you can't measure, right? So that's what I typically tell people when you get started.
You've touched on that a couple of times in our conversation, just sort of taking stock of what you have and where you are, like just finding out what devices you even have and finding out what endpoints you have, and just documenting that is a great first step, it sounds like, and then just sort of measuring it against these lists and so forth to say, hey, which are the ones that in NIST recommends you really secure and harden, and kind of figure out where you are, and then just start at the top, just knock them down.
Yeah, I mean, there's a reason why the critical security control number one is asset inventory. Like, you can't protect what you don't know you have,
Right.
right? So it's why it's number one. They're in order of priority. So it's people make a big to do about how challenging it is. And none of this stuff is, I guess, particularly easy, but we have the technology, guys. It takes a little bit of elbow grease and, getting out there, but it's not like an unsolvable problem or something like that, right? We can do it. It just takes a little bit of time, but there's tons of solutions out there to do this super cheap or even free, right? A lot of companies have made their like software available to, especially now, for hospitals. If you tons of companies are giving away software and expertise and things like that to organizations right now. So, hey, take them up on it, right? I mean,
I love it. Tom, we're getting to the end of time here that we have today, but let me ask you this. What's the one thing that you want to make sure that people listening to this take away from our conversation?
I think it's that people need to understand, I think people do, but it like doesn't hit home hard enough for some reason, that the impact or the potential impact of attacks against these environments is so severe and so significant that we really need to spend more time and energy kind of focusing on this problem, right? It's like I've said before, it's similar to the industrial control system problem, where luckily we haven't had anything super bad. We have had some issues, but if somebody's able to manipulate and access like a nuclear power generator,
Right.
and turn it off or overheat it or whatever, that is a real bad day. Like that's not going to be good. The same thing exists in healthcare. So that's kind of the thing I really want people to understand, is that this is not like theoretical, right? This can happen. It has happened. We've dodged a bunch of bullets, I think, but just because you can only dodge so many bullets.
Gotcha. I hear you. And Tom, final question. Where can people find out more information about BlackBerry's cybersecurity solutions?
Yeah, so I mean, blackberry.com. You can follow us on all the normal kind of social media platforms for information there. We do a ton of podcasts. We have a podcast called the Insecurity Podcast, and we have a active kind of social media team and all that. So anywhere, any normal social media platforms, hit us up.
I love that name for the podcast. That's probably one of the best names I've heard, the Insecurity Podcast. I love it.
Yeah. Matt Stevenson is the guy who runs that. Shout out to Matt. He's awesome.
Shout out for sure. That is a great piece of creativity. Well, Tom, thank you so much for taking the time today to speak to me and speak to our audience here at Healthcare IT Today. I do appreciate all the advice and all the information you shared.
Yeah, no problem. Thanks for having me.
This is Colin Hung with Healthcare IT Today. Thanks for listening and have a great week.